Hi everyone, now another episode of Viewers Questions Answered. Remember, put your questions in the comment section and I'll be sure to answer them both in print, but if I can't, I'll do it by the video for next weekend. So first is, due to my son's sensory issues, he didn't start fish oil, but he is eating fish sticks. I'm guessing like that you cook. Is it okay for him to do this for a while until he can take the DHA gummies? Or should we start it immediately? So a lot of people will see this reaction where the kids may stim a little bit more when they get the fish oil. This can also happen with olive oil. It can happen with all sorts of foods, actually. And typically, once you balance the gut bacteria with your inulin or rifaximin, and so you're a couple weeks in of that, the kids tolerate the stuff just fine. So here, I think that's fine. There isn't much omega-3 in modern fish that's been processed. It's a lot of it's farm raised and it's fed like corn and soybeans and stuff. So in particular, that's not going to help, I don't think, too much. But I think a delay in the fish, if you want, is not a big problem. The big key initially is getting the gut balanced and stopping the leaky gut. So it's inulin will stop leaky gut. Rifaximin can stop leaky gut from both of those for bacterial overgrowth. And then the L-glutamine, which I give now routinely to everybody for 6 weeks, that helps leaky gut if that was triggered by COVID. All right. Now here's another one about COVID. What's your opinion on multiple rounds of L-glutamine for COVID? Now again, L-glutamine is a very safe, it's an amino acid. We get it when we eat protein. It's just not enough to help us when we have, after a really high inflammatory event like COVID, it causes leaky gut. And this can go on, we think, now for 4 or 5 years. It's proving to be a very dangerous thing over the long term. And the glutamine will fix this. Now, if you get COVID multiple times, every time you think you might have COVID, I suggest 6 weeks of twice-a-day glutamine to just cover that and make sure you don't have it. It's hard to know if you're going to have long COVID. Some people, they'll get COVID, afterwards they feel fine, and then 2 months from now, they start having symptoms. It's actually long COVID. And the glutamine will stop that from happening. So it's safe to take the glutamine repeatedly. I actually have a number of parents that are just, because the kids are in school, they're getting colds all the time. It's hard for the parents to figure out what to do. They're just keeping the kid on twice-a-day glutamine as kind of preventative. And I think that's probably very safe to do. Okay, what about histamine issues that are triggered by hormone fluctuations? There's a lot of things that people are being told are histamine issues, and when they come here and talk to me, I'm like, that's not a histamine issue, okay? Now, histamine issues occur when white blood cells, called mast cells, are being triggered. And most of these mast cells are either in your lungs, and so they get triggered like when you have a respiratory allergy, or they're wrapped around your small intestine, and they get triggered when you have leaky gut. Okay, so that's really kind of what's going on with the histamine thing. But if you're having hormonal shifts and you feel kind of different, all right, that's often due to autonomics. It's not really like the hormones are out of whack. It's just that progesterone and to a lesser degree estrogen can contribute to the production, to your blood pressure regulation. And as they're fluxing up and down, the autonomic nervous system has to flux back and forth to compensate so your pressure remains stable. If you're feeling like these swings that are occurring with hormones, it's very likely due to autonomic dysfunction. And now, that autonomic dysfunction can be from past injuries, or the autonomic dysfunction can be from bacterial overgrowth. All right? But that's typically what's going on. So here, there's kind of a little confusion about two issues. And I don't really go after histamine problems. I go after leaky gut, and when you do that, generally the histamine stuff just stops. All right, next. Can you answer this question? My niece is on bipolar drugs till illegal use. Now, I truncated this, all sorts of different drugs. She's normal while on bipolar drugs. Can your protocol help her? One, something I have found with every single active or prior addict, almost irrespective of what substance they're using, is they have rather profound autonomic dysfunction and they have low blood pressure. Now, the low blood pressure will make them just feel disconnected, confused. It's like horrible ADD. And many drugs like meth, cocaine, ecstasy will boost blood pressure and it kind of makes them feel normal. All right. I've had several former meth addicts. I said, why did you use meth the second time? And they said, because I never felt so normal in my life when they took the first one. It improved their blood pressure regulation. Now, meth has this addictive component that ends up trapping them into that. And then the low blood pressure can cause also intense anxiety. And so then you have a whole range of like alcohol, marijuana, these sedating drugs, all right? Opioids that kind of sedate the intense anxiety. So all drug addicts I've ever seen can benefit from the protocol because it is designed to improve that autonomic dysfunction. It won't help the psychological loops that are developed, but at least you can make it more of a fair fight, okay? Now, bipolar disorder in particular is related to an excess inflammatory state in the hippocampus, and our protocol can help that a great deal. If somebody, it really helps people when they are consistent with their bipolar drugs. If people are not consistent with their bipolar drugs, they won't be consistent with our protocol either, and it won't have much effect. So it's they're kind of trapped in there. But once somebody is getting clean and they're really motivated to be better, we can help them a great deal with whatever the past drug use was. Next, can I have long COVID even though I don't have any gastrointestinal symptoms? Absolutely. Actually, most people with long COVID don't have any gastrointestinal symptoms. Again, long COVID. You get COVID, it can be super mild. You recover from the respiratory stuff. Sorry about that. You recover from the respiratory stuff. And then you start having these other symptoms that last, some people say 3 or 6 months, depending how you want to define long COVID. It's due to, in my opinion, leaky gut, a lot of inflammatory distress that's affecting the body. Most of the patients will have cognitive problems. You can have fatigue. You can have other neurological symptoms. You can have respiratory symptoms, like just kind of like shortness of breath and stuff like that. And they don't have to have any gastrointestinal symptoms. Okay? Anywhere from about 25 to 40% of patients will have some GI issues. And this can be kind of loose stool, got to go to the bathroom. Certain foods now suddenly are giving me heartburn. They didn't do that before. It'd be some things like that. And routinely with long COVID patients, now we put them on the protocol. I'll put them on some continuous rifaximin twice a day for maybe 4 months minimum. And then they all get a minimum of 6 weeks of twice a day glutamine. And the vast majority are dramatically improved in about 4 months. That's kind of a typical case. And we see a lot of them now. A lot of those patients are coming in. Last, I can't get sleep because I wake up 4 to 6 times at night to urinate. What can I do? This is a patient who came in. And the interesting thing here is, so everybody's like, oh, it's your prostate, it's your prostate, it's your prostate. This is a man, and but he didn't urinate frequently in the daytime. That's not prostate. If you have some blockage, like in the prostate, and you can't pee all day long, you can't pee all night long. Okay? What happens here is he had really bad low blood pressure from a prior brain injury and bleed, and he was having a great deal of difficulty getting blood pressure into his brain, and the fluid was basically pooling in the lower part of his body. Now, he had this low pressure kind of in his chest cavity where the kidneys are, and he couldn't perfuse the kidneys enough to make urine in the daytime. Also, this low pressure made him thirsty in the daytime. So he had all this excess fluid down here in the lower part of his body, and when he laid down, it now migrates up. His kidneys see it, and they're like, what the heck? Make urine. And so then the patient's like, This is the fourth full bladder tonight. Where is all this fluid coming? Well, it was from all through the daytime. Okay, this is called nocturia. Nocturia, a very common mistake with physicians not asking the right questions here. All right, that's all for viewers' questions answered for November 15th. Everybody, take care of your kids, take care of yourselves, keep your inflammation down. Till next time, Dr. Nemechek saying, have a nice evening.